Hello everyone and welcome to our channel MedStudy. Today in this video we are going to learn about normal labor, which is very important in theoretical OBGY as well as practical OBGY. So let's get started. First of all, definition. It is a series of events taking place in the genital tract in an effort to expel the viable products of conception out of womb through the vagina into the outer world. It is also known as eutosia. Criteria for normal labor include which is spontaneous in onset and at term with vertex presentation without undue prolongation, natural termination with minimal aids without any complications affecting either mother or the baby. Abnormal labor, that is dystocia, is any deviation from the definition of normal labor. Now coming to false pains, that is false labor or spurious labor. These are found more in primigravida, appear prior to the onset of true labor pain, has the following features, that is dull in nature and confined to the lower abdomen, continuous or irregularly irregular, no hardening of the uterus, no dilatation of the cervix, relieved by enema, sedatives or antispasmodics. This is relieved. Now true labor pains. These are painful uterine contractions which increase in intensity and duration of the contractions associated with show, that is cervical mucus plug and blood. There is progressive effacement and dilatation of the cervix. Formation of bag of waters, which is a certain sign of true labor. It doesn't get relieved by enema or sedation. Now pre-labor. It is associated with lightning when the presenting part sinks into the true pelvis due to active pulling of the lower pole. It signifies incorporation of the lower uterine segment. Patient has sense of relief from the cardiorespiratory embarrassment. Ripening of the cervix. Soft less than 1.5 cm in length and admits one finger. And there is appearance of false pains. Now labor has been divided into latent phase and active phase. Latent phase is preparatory phase of uterus and cervix. Active phase begins with cervical dilatation of 3 to 4 cm with regular uterine contractions. Latent phase starts from true pains till the 3 cm cervical dilatation. It lasts for about 6 to 8 hours in nulliparous woman and 4 to 6 hours in multiparous woman. It is mainly concerned with cervical effacement. Active phase, there is a rate of dilatation of about 1 to 2 cm per hour in nulliparous woman and 1.5 cm per hour in multiparous woman. Active phase is majorly concerned with cervical dilatation. Now stages of labor. There are 4 stages of labor. First stage, where the woman has contractions and her cervix dilates. Second stage, where the woman pushes, giving birth to the baby. Third stage, the woman expels the placenta. And fourth stage is the postpartum period or stage of observation. Now coming to first period. It starts from the onset of true labor pains and ends with full cervical dilatation. It is also called as cervical stage. The average duration is 12 hours in primigravida and 6 hours in multigravida. Main events are dilatation and effacement of the cervix, which leads to full formation of the lower uterine segment. Second stage starts from full dilatation of cervix to expulsion of fetus. It has 2 phases, propulsive phase and expulsive phase. Average duration is 2 hours in primigravida and 30 minutes in multigravida. Main events are descent and delivery of the fetus through the birth canal due to downward thrust to the fetus given by uterine contractions and maternal bearing down. Third stage begins with expulsion of fetus and ends with expulsion of placenta and membranes, that is afterbirth. Average duration is 15 minutes in both primi and multigravida. Main events are expulsion of the placenta. There are 2 ways of placental separation. First is central, that is Schultz method, and marginal, that is Matthew Duncan method. Signs of placental separation include gush of the blood, apparent lengthening of the cord, suprapubic bulge. Fourth stage of labor is observation stage. It lasts at least 1 hour after expulsion of afterbirths. So this concludes with normal labor. I hope it cleared few of your concepts. Please do like, share and subscribe to our channel, and don't forget to press the bell icon. Thank you.